Namaste,
Tell me, okay.
and welcome to our continuing series, Interviews with Disciples and Devotees. Today we are very happy and honored to have Dr. Raichura with us. Dr. Raichura, the first question
Yes.
I always ask is how did you hear first about Mother and Sri Aurobindo?
Well, I am from Dar es Salaam, Tanzania, but of Gujarati origin. And Dr. Dalal, A.S. Dalal, was my teacher in Dar es Salaam. I was his class student. So he introduced me to Sri Aurobindo. So I read about Mother and Sri Aurobindo from the age of 14.
My gosh.
So I've been reading since then, and now I'm 88.
88.
88.
That's amazing, really. When did you come to the ashram?
I came to India to study medicine because of ashram. Otherwise, I would have gone to UK. I studied in Bombay, but every 6 months I would be in ashram. I came to ashram first time in February 1953. So I've been seeing Mother for a long time. And I've had a lot of experiences, spiritual experiences with her. In fact, when I was walking in Dar es Salaam on a beach road, I saw her in front of me in the sky, looking at me. She walked all throughout my distance of about half an hour. She was with me. Afterwards, I realized it should be Mother, nobody else. And it was such a happy walk that I can't forget it. So she has chosen me from when I was 15.
When did you first go in front of her?
In front of her, I have gone not very little, 2-3 times. I received on the Mother from her hand. I also received his 88th birthday book from her hand. Plus my daughter, when she was born in America, I brought her here. She was only 3 months. So I took her to Mother and she played with her. She is in America, but she named him Madhuri that time.
I see.
I had long association. I have seen Mother 5 times a day at the time when I used to come, because she used to be out quite often.
Yes.
Darshan was quite common also. And also flower distribution at 9 in the morning in the meditation hall.
Oh.
So I have received it for months from her.
Playground?
Playground, of course, meditation with her, Thursday and Sunday. Long association.
You told me you had many things to tell me.
Of course.
I'm ready to hear.
You know, Mother told Dr. Satyavata Sen, who is a surgeon, was at Treasure Nursing Home, Chitradi's brother. So, Mother told him, all this story was told to me by Chitra.
Oh.
And she told me that Mother told him to develop treatment for inner disharmony. Mother told him to develop treatment for inner disharmony. He could not do much being a surgeon. And he died of heart attack. He was a smoker also. So I started through even society learning about pranic healing and many other things. I have, of course, deep knowledge of medicine. So I started studying because I saw that there were a lot of problems in the healing work in allopathy. So I started taking interest in other therapies. So I studied all different therapies for the last 25 years. I know about pranic healing. I learned about scanning. Then I know about color therapy.
What about homeopathy?
I know about homeopathy. I know about Ayurveda. I have found shortcuts in therapy for Ayurveda and also for homeopathy. Shortcut.
Very interesting.
All the work I am doing is through intuition. Everything is done through intuition. Without intuition, you can't do this work. Without scanning, you can't do this work. And then Sri Aurobindo talks about mystic fire in Savitri.
Yes.
So I was doing mystic fire therapy without knowing what Sri Aurobindo called it. That means I was going from the intuitive level, order a therapy, and it will be worked out in seconds. Then I came to know that such therapy exists even in USA, and it is called delta energy.
Oh,
In USA, it is called delta energy.
delta energy.
So there are levels of mind: higher, illumined, intuitive, and overmind, and and of course supermind. So higher mind you do through meditation and contemplation. That is working through cooling your mind. Then the illumined mind is theta therapy. That is what they use by the Japanese and all. That is called. I'm forgetting the name. Getting old.
Theta therapy.
Yeah, theta therapy, but there is another name which commonly used. Anyway, this is not enough for doing work which I am doing. So I had to go to a higher level that is called delta energy. And that Sri Aurobindo calls it mystic fire. So I use mystic fire. In mystic fire, you order the therapy and it is done in seconds. But your diagnosis has to be correct. Your ordering the therapy has to be correct. So your knowledge of therapy is needed. Your protocol is needed for therapy. So I developed about 300 therapies over a period of 20 years. But in the last 1 year, there is not much work. So I started doing more research. I have developed 200 new therapy in the last 10 months. I've been able to do things which I could not do before. I have a feeling that this was possible because of the descent of the supramental energy. The supramental energy has changed the world. It's a new world. I'm feeling the effect of it in my therapy work, which I could never do before, I'm able to do now. In the last 10 months. I am also flabbergasted what things are possible now which was not possible before.
Can you give me some examples of your therapy?
Like retinitis pigmentosa, patients are blind. There are so many therapies. Then Parkinson's disease. I have cure for Parkinson's disease. I have cure for coronary heart disease. I have cure for arteriosclerosis. I have cure for diabetes. I have cure for, treatment for autoimmune diseases. There are 100 or so autoimmune diseases. And I have answer to all.
Even diabetes.
Diabetes, even I had type 1 diabetes is autoimmune, but type 2 is not. But since the last 10 months, I have found treatment for diabetes type 2. And it cures.
Maybe you could talk a little bit about your education in medicine.
Yeah, I am MBBS from Bombay. I went to USA, did my American board, and then did FRCP from Canada, Montreal. And came back to India. I met mother. Mother said, no to America. She says, Africa will be difficult. I'm from Africa. And it turned out that a year later, all the practice in Tanzania was nationalized. So she was right. She said, it's going to be difficult. She said, India preferable. So I have no roots in India, but knew Bombay, so I settled in Bombay. It was tough. 5 years of stay in Bombay was tough. I found it extremely difficult because the practice is completely corrupt.
The practice.
Practice all over India is corrupt, all over the world is corrupt. Bombay is worse. So I was feeling horrible. So I prayed to Mother, get me out of Bombay. I didn't know where to go. I got an opening in the Middle East, Abu Dhabi, in the Ministry of Health. So I applied. It took them 4 years to accept my application. So I became the head of the medical department in Abu Dhabi, Ministry of Health, knowing my qualification. So I worked there for 10 years. I asked Mother whether I can go to Abu Dhabi or not. So she said yes. Without her permission, I would not have gone. And her help was there all throughout. It was very difficult practice to handle Bedouins. They are very difficult people. They can lose their head and they can throw you out of the country any moment. So there was a joke among doctors that please keep your suitcases ready. You don't know when you will be thrown out. It was a big joke. But anyway, I stayed there for 10 years with her grace. And then I got within a call, come back. Because I had one daughter and one son, and they needed to be admitted in ashram school. One was 9 years old and the daughter was 13. So we decided, we resigned. I asked her permission, yes, resign. I got the answer. So I came to Pondicherry straight away. In the meanwhile, I had already bought a plot on this road. And the house was ready at the time when I came. My wife came 1 year earlier. She is a radiologist. She's American board radiologist. She works for Ashram nursing home. I don't know if you know about her. Dr Raichura. So that's how I started.
You landed here what year?
I landed myself permanently. I came in 53 first and then landed permanently in February 1984.
So you were going back and forth?
Yes, all the time. Every 6 months I'll be here.
Tell me a little bit about scanning.
About? Scanning. You see, I learned scanning from pranic healing. You can't do pranic healing without scanning. Choa Kok Sui, a Chinese in Philippines, Manila, he started it. He has written 3-4 books on it. I read all of them. And I studied it thoroughly and I practiced it. So I learned scanning. Without scanning, you cannot make a diagnosis. Because it's all fourth dimensional. Making diagnosis is fourth dimensional, not third dimensional, not laboratory and microscope and blood test and whatnot. It is completely different. Because you are going much deeper than what allopathy can do. That's why allopathy has problems in treating difficult cases like Parkinson's, Alzheimer. Alzheimer, they don't know how to diagnose. They make wrong diagnosis and there is a wrong treatment. There is no treatment. I can cure Alzheimer in 3 months. I've treated 30 people and all are cured. Alzheimer. The tough job. So what I am practicing is a future medicine. It's not a present medicine.
This is very interesting.
Absolutely.
So,
it's a supramental type of work, almost.
So Ayurveda doesn't come into the picture very much?
Beg your pardon?
Ayurveda?
Ayurveda, you can scan if the patient needs Ayurveda or not. If the scan is positive, there is only one simple treatment. Vata, Pitta, Kapha. All Ayurvedic, 90% of the Ayurvedic therapy is dependent on Vata, Pitta, Kapha. It should be 1/3, 1/3, 1/3. If Vata is high or Kapha is high or Pitta is high, patient gets sick. That's the whole theory of Ayurveda. So I can, with delta energy, I can cure Ayurveda by ordering it, make it 1/3, 1/3, and 1/3. And it is done in seconds, and the patient is cured from Ayurveda, the treatment he needs. 90% of the treatment can be treated. 10% you may have to go to an Ayurvedic doctor. But even Ayurvedic doctor makes mistakes and gives wrong medicine, and they are right only in 70% cases. I am right in 90% of cases.
So,
Same thing with homeopathy.
yes.
Same thing with homeopathy. I can diagnose whether a patient needs homeopathy or not. In my case, it is done through intuition. And then I can scan which medicine is suitable for that patient by looking at the whole list of homeopathic drugs. So I can find out in 5 to 10 minutes which medicine is going to go for which patient and for what problem. If somebody needs homeopathy, then only I pick up homeopathy. Otherwise, I don't. So if the scan is positive, I put that medicine which has to be given on the scan, and if the scan goes away, that means the medicine is correct. So I'm 100% sure of what I am giving, whether it's going to cure or not. So I'm better than even a homeopath. A homeopath uses sometimes 4 or 5 drugs. They have a choice of 4 or 5 drugs. A homeopathic doctor worked with me, and then she will suggest a treatment. A highly qualified homeopath. So I said, no, this medicine you are suggesting is not going to work, because through my intuition. So I said, please give me the choice. So he'll give 3, 4, 5. I said, this one. Then I tell her which is going to work, which that homeopath is not sure about, because there are 3, 4, 5 choices for one diagnosis.
Now, you mentioned this scanning, and you said if the thing is right, the scan goes away.
If you put the medicine, what you have chosen, on the scan should become negative. You understood?
Yes.
Yeah.
Yes. Very good.
There is something called placebo effect.
Yes.
It's a big subject. It cures 70% of the problems. Placebo. So when patients used to go to mother would say, yes, you go to Ayurvedic doctor. The patient says, no, I don't believe in Ayurveda, I only believe in allopathy. Okay, you go to allopathy. Okay. But she has already treated him. So without a tablet or a proof to the body that he is getting treated, you don't get treated. That is a placebo effect. Taking tablet medicine is a placebo effect. Even though it may not be the correct medicine, it is going to help 70%. Because you believe that this medicine is going to cure me. So it is...
I want to understand more about scanning. You say it's from the intuitive mind?
No. Scanning has nothing to do with intuition. It is an ability to... It is called... clairvoyance?
Clairvoyance.
Clairvoyance. I'm not a clairvoyant. Means you can see aura and organs and scan through clairvoyance. That is called clairsentient. Sentient means awareness. So that awareness comes through scanning. So one has to be clairsentient to be able to do this work. I scanned you and found that you were 90% clairsentient. I treated you yesterday. And I found out that I can treat you. I treated you for clairsentient. Now you are able to scan 100%. I'll be able to prove it to you that you can scan.
You can teach scanning to anyone?
I don't, because it's a tedious work. I don't have time for that because I'm busy with many things. But if somebody is 90% clairsentient, I can treat him with clairsentient therapy and he will become 100%. He will be able to scan. I'll prove it to you that you can scan.
I'd like to ask a bit about your education in the ashram. Did you have any education
I
here?
never, no, naturally, because I was studying medicine and it was a very hard job to learn medicine and to become specialist. It was very difficult. I'm a hematologist, blood disease specialist, but I did a lot of cardiology work. I know echocardiography and many things. I can treat heart diseases, cardiomyopathy, and many things. I've treated in ashram, and I know echocardiography. We had an echocardiography machine in the nursing home, and I used to use it.
Did you know that I had open heart surgery?
You have coronary heart disease, that much I know. You have coronary arteries, which are blocked also I know, by scanning. I can scan all your coronary arteries and tell which artery is blocked and how much, what percentage. You remain younger by doing work, particularly psychotherapy, because psychotherapy, you can use it on yourself and cure yourself, so you can prolong your life. You see, sadhana is practical psychology. Sri Aurobindo says, sadhana is practical psychology. Okay? Psychotherapy is practical psychology. So yoga and psychotherapy have similar background. It is like adding fragrance to gold. Sone mein sugandh mili. In gold you add fragrance. So the combination of sadhana and psychotherapy is like adding fragrance to gold.
Not psychoanalysis, though.
Psychoanalysis is more mental. Well, psychotherapy is dependent mainly now on delta energy and mystic fire. So you don't have to question much because you can diagnose without talking to patients. When a patient comes to me, I already know what is the problem. But the patient doesn't know that I know, and patient himself doesn't know what is the problem. So when I start asking questions, yes. He says, how did you know? Well, I found it through scanning. I said, you are depressed. No, I am not depressed. I said, but you are. No, I don't believe. Okay, I'll treat you. After 1 to 2 weeks, you come and tell me what happened. He will realize he was depressed because he sees the difference. People don't have insight into themselves. This is the main problem even in sadhana. It's the main problem in sadhana. No insight into themselves. And they don't know what they are doing, what they want, what they should pray for. Sri Aurobindo considerably gave importance to intuition. He says mind is not an organ for knowledge. Mind cannot take you to knowledge. It's only intuition which can give you the correct diagnosis. Without intuition, you can't handle things much. He always emphasized intuition. Many people talk about intuition, but they don't know what it is. This means a direct perception of truth. You don't have to think. No saying pros and cons. You just know. If you say an elephant, he is an elephant. See, that is called intuition.
You've opened up a big range.
It is mine. It is all sadhana range. It's taught by mother and Sri Aurobindo.
I wanted to ask, you studied with Dr. A.S. Dalal.
I studied in the school. But he was my mentor because he knows so much. He was PhD in philosophy from Pune University. He was an authority in philosophy. He was a gold medalist, came first class first. He was brilliant and a superb speaker. I used to adore him. So I learned a lot and he guided me all throughout.
His books are very well appreciated.
Correct, because mother told him when Nolinida writes, he goes above the head of people. But when you write, it goes straight to the head of the people. This is what mother told Dalal. Dalal told me this. I'm very close to him. I always see him every one or 2 months. And we are very close. And he is a PhD in psychotherapy from USA. And I am a psychotherapist in my own way.
Who did you know well in the ashram of the greater ones?
I knew Nolinida. He was being a doctor. He used to take my treatment. I knew MP Pandit very well, and he used to take my letters to mother and get answers for me from mother. I knew Purani. I used to go to his Savitri classes. So I know several people. I also knew Amritada, who was actually what was his name in Italy? That painting he did in Vatican. Not Leonardo da Vinci, but the other one. Michelangelo. He was Michelangelo. Amritada. Which Nalinida told everyone. He said, mother told me.
Did you know Pavitra?
Yeah, I didn't know personally, but I saw him many times. But no.
And what is your feeling about the ashram work now?
Ashram work in what sense?
Integral yoga.
Integral yoga, very few are doing. Only maybe 10% of people. Most of the people are admitted in ashram because of need of workers. It's a big ashram. It needs a lot of workers, like in dining room, like in nursing home, in Shabda, many places. So they need workers. How many are ready for sadhana? Is a question mark. Not easy, very difficult. So there has to be a compromise. There is no way of running this ashram just to talk. No, I only will take people who are ready for sadhana. Very few people are ready. But this compromise is needed. There is no way out. There are something called vital beings. I don't know if you have heard. Vital beings don't have psychic being. They don't have psychic being. They come from Saturn, Jupiter, and Mars. Mother told there were 4 gods which are brought to take care of creation. They went against the divine and started taking the control over themselves. And that produced the, what you call, Rakshasa or what, I don't know. One of them was after Hitler. And he controlled Hitler and made all the wars which were needed for him to take control of the world. Rakshasa knew, it's called Lord of the Nation. Rakshasa knew that if Sri Aurobindo and the mother succeeds in bringing down the supermind, their days are numbered. So he used to stand outside Sri Aurobindo mother's room, watching what is happening in this place. And he tried to interfere whatever way he can. And this worked through vital beings who don't have psychic beings. These vital beings don't have conscience. They have no scruples. They are self-centered, egotistic, and very aggressive. They will do anything to get anything. They are also suicide bombers. What we see in the world everywhere is done by vital beings. Stalin was the strongest, mother told that. And so are the Osama bin Laden, as well as Iraq's controller, Saddam Hussein. All these are vital beings. There are many leaders, politicians in India who are vital beings. I won't give the names. So, vital beings, about 50% of the population in the world are vital beings. Can you imagine? Mother got fed up of human beings. She wanted to leave. She has told about all this in agenda. And Krishna used to walk with her. Krishna stopped walking with her because he thought that if she continues to walk, she will lose interest in the world and leave. He didn't want that to happen because the Superman has to be brought down and brought down safely so that it remains. It doesn't retreat after coming down, which mother had to do, which she did. So this is all written in agenda.
But you explain it very beautifully and very clearly.
Well, my study has been very long on the subject and contemplation, and I think a lot about what I am doing here, why I am here, why mother brought me, what's the aim of what we are all doing, what is evolution.
So you continue your practice.
I know allopathy, but for some different reasons, I left allopathy because they were not able to appreciate what I was doing. There was a lot of resistance among the allopaths. Allopaths are against alternative therapy. Even though I am an allopath and a very well trained and educated allopath, I know everything about allopathy and I know what are the pitfalls in allopathy. So I have tried to find answers which cannot be given by allopathy.
Can you tell us just a little bit more about the supermind that you're experiencing?
My experience, well, very little. Of course, we all have little because it has just come. It's a new world. And I am seeing the result of the new world in my new research that I am doing in psychotherapy. I am amazed with what I can do now than what I could do before. So there is a big difference in getting the answers. And I feel it's a sign of supermind. Sri Aurobindo said that the sign that the communications have spread out so fast, internet and whatnot, is a sign that the supermind has to come down. This is what Sri Aurobindo said.
I'd like to ask you a little bit about Oroville.
About?
Oroville.
Oroville, well, every place is facing problems. Even mother faced problems. She was fed up with human beings. So there are lot of weaknesses in human beings. And there are vital beings all over the world, including Oroville and ashram. And they are leaders in some of the departments. Because they are aggressive, they have ability to, do things which nobody else does, like suicide bombers. It's not a joke to do all that work.
When you say vital beings,
I am not saying what Mother and Sri Aurobindo has said.
Do you equate them with the Asura?
Almost. Yeah. They are Asuric. Vital beings are Asuric. They can curse people. And it is called shamanic attacks. I found cases and cases of shamanic attacks on patients, and it has created havoc in the patients. A wife may be a psychic being. I call psychic means having psychic being. And husband may be vital being, no psychic being. So the husband can curse the wife. And it can create havoc in the family life, particularly very devastating for the offsprings, children.
What do you see in the world today?
The world today, well, I would say I would not like to be born for another 500-600 years because things are not good everywhere. Politicians are simply, devastating. The way they try to control masses, it is miserable. All over the world. Look at the Chinese behavior. So it's the case all over the world.
When Mother speaks about crashing circumstances,
Yes, so why, in what sense she used it?
if we don't change.
Yes. You picked up a new topic. I feel Corona is one of them. People are absolutely careless, and they are paying with their lives. There is nothing called hygiene in their life. All this thing is pressurizing them to change. This is one of the way Mother had said that if people don't change, they'll be pressurized to change. And this is what is happening. I feel one of these attacks are due to that. And particularly these are brought up by the human beings' vital weaknesses. Mother had said when it came first time in not first time, every 100 years it comes. So it came in 1917 and 18. I was not there. And many, many people died all over the world with influenza. Even Sri Aurobindo's wife, Mrinalini Devi, died of that. She was to come to ashram. Sri Aurobindo said, yes, you come, but she could not reach here. These are all facts.
So you see this corona as a way to make people change?
It's not corona, it is suffering, refusing to change, remaining adamant and aggressive and self-centered. All these things have to go before supermind can come down and do anything. It cannot work on ego. Ego has to go.
It's wonderful to have you with us.
Oh, thank you very much. Any more questions?
How do you make use of psychology when it comes to scanning and in your...
Psychology is a knowledge of mental diseases. So how to diagnose from which level the psychological problem has come? Has it come from the physical? Because physical diseases itself can produce psychological problems, and vice versa. The psychological can also produce physical diseases. Same way, is it emotional? Is it mental? So you should know from which level the problem is coming. So the knowledge of psychology is essential. Dalal has written a book, very good, nice book on that subject. He's given a lot of information about it because he himself was a psychotherapist, PhD in fact, from USA. He was also PhD in psychoanalysis from USA. So he has tremendous knowledge. But he could not scan or could not use delta energy. So all his work was mental. To treat people mentally by counseling, it takes a very long time. In Europe, they are open to counseling, but not in India. In India, they think counseling means you are mad. How can you go to a psychiatrist for counseling? In Europe, everybody goes. Any problems of marriage, the couple go and ask how to solve their problems. It's a serious issue, marriage, because it affects the lives of their children. And whole social strata is affected unless you are cured in psychological matters.
Can you define the word scan for us?
Scan is a four-dimensional energy scanning. There is something called physical, there is also called auric. You see, physical body cannot be produced unless there is an aura about it. So the precipitation of the physical body is according to the aura which is there. So fourth dimension is a must. Without that, you can't exist.
Like in psychology right now, there is transpersonal psychology,
Correct.
which is the fourth, opening towards the fourth dimension.
That is correct. It's the opening to the fourth dimension. I agree.
But at present, I feel it's very mixed.
Naturally, because fourth dimension, how many can go? Few can go reach there.
Because I myself in my masters, I did a research on the chakra healing.
Oh, fantastic.
And I myself saw results, like even if you do not have knowledge of the chakras, but just turning your consciousness to it, because that chakra itself is powerful enough to imprint upon you its healing powers.
No, that is not possible. Chakras are dynamos. They don't have the power to impose anything on you. That depends upon your power, your chakras. The power comes from your inner spiritual growth. It doesn't come directly from the chakras. No. It comes from the higher level of consciousness.
But concentrating upon it can open your...
Chakras are auric level. There is a physical, auric, vital, emotional, vital, psychic and spiritual, and again supramental, overmind and supermind.
Sir, it has been an honor. Thank you.
Oh, it's a pleasure. It's a pleasure.
Namaste.
Thank you.